All right, good morning or good afternoon. I'm going to talk a little bit about a TURP or TURP or grandiurethral resection of the prostate or the Roto-Rooter. And so that is a procedure, it's a surgery that I perform for BPH a lot. The reason why is because it works. Um, it's actually been around since the year 1870, since the time electric cautery was invented. It's one of the first things that urologists did. Obviously, there have been some major updates. Actually, most recently, the use of bipolar cautery so that we can really get great control of bleeding at the time of the procedure. Um, but it's been around for a long time, and that's because it works well. Um, I use it for prostates generally between 50 and 100 grams. And for patients who have bothersome symptoms despite medicine, it's a great option. Um, and so, what is the TURP? We might have talked a little bit about it in the office, but basically, I want to make myself smaller here. The point of the TURP is to go from the middle to the one on the right. So you can see that the prostate in the middle is totally obstructing the outflow. And on the right, a big chunk of that prostate has been removed, and now the outflow is great. You'll notice that the outside remains preserved, and that's really important. A lot of people say, well, why don't we just remove the prostate? It doesn't really do anything, which that is true, except on the outside of the prostate, there's a lot of important nerves for continence and erections. So when we do cancer surgery and a radical prostatectomy, then we have different issues than after a TURP, um, where we're talking about urinary leakage and erectile problems. We don't really have those problems after a TURP because we leave everything intact on the outside. And so for like kind of, and I'm gonna make myself bigger, but I'm gonna show you a quick animation. Okay. So this is the scope going into the prostate. Okay, and there's that loop of cautery, and basically you just scrape out this excess prostate tissue. Okay, and that's really all I'm doing. Then, that does cause some bleeding. And now that's a really extreme amount of tissue resection there. Um, it's much more typical is what I showed you in that PowerPoint in terms of how much prostate gets removed. About 30 to 50% of the prostate gets removed. Um, and so you can see that you're removing that area, and then there's going to be kind of a healing tissue. So the one thing to know after a TURP is your urine is going to look bloody for up to 4 weeks. It may not even be active bleeding. It probably won't be active bleeding after a certain period of time, but that tissue has this kind of healing tissue, almost like a scab on it, and the urine is running past it. So it stains the urine rusty, brown, kind of sometimes red, all sorts of different colors. And so that's something to be aware of, that you are going to have some blood in your urine that will appear. However, the risk of being admitted back to the hospital after a TURP for bleeding, because now you're passing like large clots, active bleeding, stuff like that, the risk of that is 2%. The risk of infection is 2%. And then the one thing to know about a TURP is that once you do that, then you're going to get, like I said, no problem with erections. You'll feel orgasm, but you won't have your ejaculate coming out anymore through the penis. You'll have an orgasm, and that ejaculate's going to go backwards into the bladder. So it's totally harmless, but that is something to know going into a TURP is that's going to happen. I do my TURPs as a same day procedure. There really isn't a need to keep people overnight for irrigation anymore because we can get really good control of bleeding in the operating room, and they go home the same day. The catheter stays in for 3 days, and then the catheter comes out. Once the catheter comes out, your urine, your stream is going to be immediately better. I'm going to go back to my PowerPoint here if it'll let me. Let's see. Hopefully it'll let me. Nope, it's not going to let me. Oh man. Okay. Um, so your stream will be immediately better, but we probably talked about the bladder thickening as part of the disease prostate with a large prostate. Sorry, the disease process with a large prostate. And then when that bladder thickens, that's when you get the symptoms of urgency where you have to run to the bathroom. It's not giving you any time because it has a really strong muscle. So imagine now that prostate's been suddenly like removed. That area of the prostate's been removed, not the entire prostate, but that area. So now your bladder's still squeezing though. So what can happen after a TURP is that you have sudden increase in really urgency that you have to get to the bathroom. And that's because the bladder has been thickened and everything. I can give you a medicine to help with that once I see you back and make sure that you're emptying your bladder okay. But that is something to know that you may have some significantly increased urgency just for like, at least a couple of weeks or something like that. Then the bladder configuration will go back to kind of more normal. Sometimes men have to be on overactive bladder medicines after a TURP because we kind of unveil this overactive bladder situation by removing the obstruction. So really those are the kind of main points about a TURP that you need to know going into it. And if you have any questions, you can always call. Have a wonderful day.